Hello, good morning, good evening from whichever time zone you're watching. My name is Harshal, and let's straight away start with the practice set. This is the practice set for chapter medicine from CPT book. If you're someone who is preparing for a medical coding certification or someone who is just a medical coding profession, why not watch my other videos as well? And please leave a like and subscribe to this channel, Decode Healthcare with Harshal. Coming to this question, an audiologist carries out a comprehensive 45-minute time-based evaluation of a patient to determine candidacy for a complex bone-anchored hearing device utilizing the updated CPD 26 framework. What is the correct code assignment? You have got around 4 to 5 minutes to answer these questions. Uh, Refer to your CPT book, read out all the four CPT codes mentioned over here. Try to get the best possible CPT code here. If you have already got the answer, why not move ahead to 3 to 4 minutes where I am telling you the answer to this question. And also, thanks for mentioning uh, the feedback in the comments. Let me know the feedback for this video as well in the comments. I'll try to make it better as I can. And also, yeah, I do help medical coders, so please subscribe to this channel. I don't claim anything otherwise. All right. Coming to this answer to this question, option D is the right answer here. As 6 to 8 represents the initial time block for the evaluation of hearing device candidacy. All right. Moving on to next one. Next question here. We go. A 3-year-old child undergoes comprehensive audiometric testing, including ear tone audiometry and speech audiometry by an audiologist. What code is built here? If at all I get somewhere wrong, please let me know in the comments. I've just done a single check. Uh, I do work on multiple codes at a time, so that is why I might miss out on something. If at all there is something I have missed out on or got something wrong, please do let me know in the comments as well. All right, time to answer the question. Answer to this question is option C, comprehensive audiometry, pure tone and speech audiometry is included in CPT code 557. That is option C. Moving on to next question. Spontaneous tacmus testing with electroculography, recording, and vertical positioning is conducted in a specialized vestibular lab. The physician interprets the final data tracing. What code is selected here? All right, time to answer this question. Answer to this question is option B. That is 92541. As spontaneous TACMIS testing with recording is reported via this port. Moving on to next question, starting with cardiovascular in chapter medicine. An interventional cardiologist performs a percutaneous transluminal coronary angioplasty, which is also called PPCA, in the left anterior descending coronary artery and places two separate drug-eluting stents within the same LAD, that is left anterior descending vessel, during same operative session. So two stents in one single vessel. How should this intervention be coded according to 2026 rules? If you like what I'm doing, please like and leave a subscribe. And also subscribe to the channel, man. It helps me a lot, motivates me to do more. All right. The answer to this question, question 5, is option B. So according to new rules, multiple stents in the same major vessels are revised. New code 92930 was introduced to describe the single session placement of two or more stents in the same major coronary artery or bifurcation lesions. So that is why option B, Bombay, is appropriate here. Moving on to next question, question number 5. A patient presents with a chronic total occlusion of the right coronary artery. The interventional cardiologist successfully opens the vessel using a complex combined antegrade and retrograde approach. What is the correct CPT coding done over here? All right, time to answer the question. Answer to this question number five, where it's CTO done for RCA. The answer is option C, that is 92945. Now, why is that? Because in 2026, a new code was introduced to specifically capture PCI, that is percutaneous coronary intervention for CTA, that is chronic total occlusion, when using a combined antegrade and retrograde approach, differentiating it from a standard single direction CTO approaches. Moving on to next question, an electrophysiologist performs an electronic interrogation and full programming of baroreflex activation therapy system in an outpatient clinic. What code should be assigned for this 2026 service? All right, time to answer the question. Answer to this question number 26 is option B for 415, as this is code for the interrogation and programming of PAT devices. All right, moving on to next one, question number 27. A patient undergoes a complete left heart catheterization via retrograde brachial artery access with selective coronary angiography and a left ventriculogram. The physician provides a de-injection procedure, imaging supervision, and full interpretation. What is the correct code we built here? All right, time to answer the question. The answer to this question is option B for combined left heart catheterization with selective and a left ventriculography is reported with code 93458. Since you have, if you are ever reporting it for only for professional services, you will be appending modify 26 with this code. Moving on to next question. During a diagnostic left hand catheterization, which is also called LHC, the physician decides to perform a pharmacologic coronary drug infusion to evaluate coronary vasoreactivity. How is this drug infusion coded? If you like what I'm doing, please like to this video and also subscribe to this channel. All right, time to answer this question. Question number 28. The answer to this question is option B. For infusions of this drug during diagnostic or therapeutic intervention is coded as an outcome code that is 571. So 571 is only option B. That is why we'll go with option B. All right. Moving on to last second question. A 12 lead ECG is performed in an urgent care clinic. The clinic owns the ECG machine and an independent physician is contracted to provide a written interpretation and report. What should the independent physician be? Remember, we are coding here for only for independent physician. Again, a reminder, you guys, please like this video and subscribe the channel. Over 70% of people who are watching this do not subscribe to this channel. I don't know why. It doesn't take you much, and you'll be keeping on getting the videos on your feed once you have subscribed to this channel. All right. Time to answer this question. The answer to this question is option C, 93010, as it is only built for professional components. Only we do not require to build a modified 26 here. Moving on to last question to this question set. A patient is fitted with a 48-hour Holter monitor. The continuous recording is initiated in the clinic. The patient returns home, and the latter, the tape is scanned, analyzed, and a report is written by the same clinic physician. What code is applied? Also, do let me know in the comments if you want me to do a particular set of questions for any chapter. Could be research discipline, could be a chapter from surgery, or ENM, could be anesthesia, radiology, pathology, or some chapter from ICD, a random chapter. Or if you want me to do it on PCS, procedural coding system, I can do that as well. Yeah. All right. Time to answer this question. The answer to this question, last question, please like, subscribe, and comment on this video. Option C, 224, which represents a global service for continuous ECG monitoring up to 48 hours, 2020. All right. See you in the next one. My name is Harshal, and yeah, thanks for liking and subscribing to this channel, Decode Healthcare with Harshal. I'll see you in the next one. Till then.